Now to call in Congressman Anthony Weiner, the Democrat of New York. Thank you again for some of your time tonight, sir.
Thank you.
Senator Landrieu said the public option is being sold as a free lunch. The president was very clear. It's not a free lunch. The public option is a self-sufficient, self-sustaining enterprise paid for solely by premiums out of the system and into the system. So who other than those who are dedicated to destroying the public option has tried to sell it as free health care?
Well, as a matter of fact, the American people are supporting the public option because despite what the health insurance industry and some senators think, the American people understand they want additional choices. You know, I created this website, countdowntohealthcare.com, thinking I would use the petitions I gathered to lobby my Republican friends. I seem to need it much more with some of my Democratic friends because, frankly, there's more misinformation being spread out there, and it's not just people like Chuck Grassley, who I got to tell you is one fry short of a Happy Meal if he thinks that Congress can't do this. But it's a lot of my moderate Democratic friends are turning out to be our biggest headache here because they don't seem to understand this proposal very well at all.
I already like that name of your website, countdowntohealthcare.com. How are you using it to tilt against these reluctant Democrats?
Well, I just want to tell you I checked. I didn't step on your trademark much. Look, we have over 30,000 people, and when we started looking at the zip codes these people are signing up saying we want a public option at countdowntohealthcare.com, a lot of them were from the so-called swing districts. Despite the mythology, it is these citizens who voted for Democrats because we said we were going to fix health care. Now these very same representatives are running for the hills claiming their constituents don't want it. I think the American people want alternatives. And the health care industry over the last several days has done exactly what they hardly ever do, told the truth. They've been saying they're going to raise rates. They're saying it loud and clear. They're begging for us to include competition in this bill. And if we don't do it now, we only have ourselves to blame.
And we also, during this bizarre week, found out, many of us to the surprise of many of us certainly, that the antitrust exemption is firmly intact. It and Major League Baseball have this, and that's it. Is it amazing to you that we're still having a conversation about whether or not it's a good idea to rein these companies in?
Well, you know, the healthcare industry takes home every year in the neighborhood of $200 billion in profits and overhead. That's money that doesn't go into a checkup, it doesn't go into Operate Anyone, it doesn't get us any health care at all. It is remarkable to me that we have the Republican Party, a wholly owned subsidiary of the insurance industry, teaming up with a small group of Democrats to try to protect that industry. I just don't get it. And sooner or later, the American people are going to weigh in and say, enough is enough. I'm glad Nancy Pelosi is hanging in there as tough as she is.
About Senator Snowe at the negotiating table, whether she is there or not, the story has changed in the last 2 days. Does it seem evident to you that enough Democrats in the Senate and maybe enough Democrats in the White House have all but given up on the public option or are ready to, unless they are backstopped in some way?
I don't think so, and I hope not. You know, I think that, frankly, if you don't have a public option, I don't think you can pass a bill out of the House, and I think that the White House gets that. You know, at a certain point, President Obama has to put his finger on the scale here and say we need to have a public option. I at least give Senator Snowe the credit for seeming to be engaging in a serious debate. When you see Chuck Grassley pulling these bizarre constitutional theories out of, I'll leave it to your viewers to imagine where he's taking them from. But, I mean, you really do see how bankrupt a lot of this debate has become. At least Senator Snowe is trying. But this bill, if it does not have a public option, not only will it not save money, but I don't think it becomes law.
Congressman Anthony Weiner, the Democrat of New York, once again, great thanks for your work on this and for your time tonight.
And for countdowntohealthcare.com.
Excellent.
Thanks.
No impingement there whatsoever. Thank you. For more